Hey everybody, today is all about lips and the precision lip technique that we teach in our level 2 dermal filler course. So this patient has had lip filler several times before, but it's been about a year since her last treatment, and we are using Revanesse Versa, which is a medium filler. She's looking for volume, but not a crazy amount of volume. And you can see that I've backfilled my product into a 31 gauge 8 millimeter needle. And this really helps me get that precision that I'm looking for. You'll see initially we're just sort of outlining the vermilion border, giving a little bit of volume in the body of her lips as well, just to try and bring back some of that volume she's lost since her last treatment a year ago. And you can see initially she got a bruise pretty quickly right on that top lip. And coming up, you'll see she gets another one. This patient, unfortunately, is fairly prone to bruising. And so this is a patient that I recommend starting arnica on a couple days in advance, and then she'll take it post-procedure as well. But just keeping in mind, being able to tell the difference between a bruise or a hematoma and a vascular event is incredibly important. And I'll show you at the end. We're going to check a little bit of capillary refill before I send her out the door, just to make sure everything is good. And then I did see her 2 days later as well, just to follow up on those bruises and make sure that nothing looked any different than when we saw her. But at this point, we're just sort of creating a little bit of definition in the Cupid's bow. You can see that we're fanning in that middle lip coming through her Cupid's bow. And this is sort of the beauty of the precision technique, is you aren't just filling in linear struts anymore. You can really sculpt and shape the lips coming from all different angles. And so that's why I wanted a little bit more precision with this lip case, because I knew I was going to want to be defining the vermilion border and trying to raise the Cupid's bow a little bit and just creating some really pretty shapes. So this is why I used the technique that I did. And again, when we use the ComfortDoc syringes, of course, this is done using a sterile technique to prevent contamination of your product. And so we filled that back into these 31 gauge needles so that we can use that for the procedure itself. You can see the patient's tolerating this really well. We did numb her for 10 minutes with a topical anesthesia, and she seems to be doing quite well. Also keep in mind your product does have lidocaine in it as well, and so that is another component that will help keep her numb even throughout the procedure as we continue to work. So at this point, I'm just finishing the top, and we'll move down to the bottom to really give her some volume in the bottom, but also, as you can see, of course, she's swollen, but we need to make sure that we have appropriate proportions. And so we'll do some on the bottom as well. There you can see that other bruise at the top, her top left lip. So again, very prone to bruising. This can be very expected for any patient, really. Using sharp needles in the vascular lips, it can happen at any point. So just keeping that in mind. So we can see we're laying that product fairly superficially in the lip. And we'll go back and give her a really nice massage once the procedure is done. I don't like to put a whole lot of product into the corner of the lip. It tends to look less natural. However, the product does have hyaluronic acid in it, and therefore it will hydrate the lips. And so sometimes I feel like if you leave that corner untreated, it looks a little bit wrinkly still, where the rest of the lip looks nice and smooth and plump. So I do generally put like a very, very small amount into the corners of the lip just so that it gets that hydration. But I tend to focus most of my volume sort of on that mid lip, creating like a very nice, pretty pout for the patient. A lot of people tend to like that pouty look, this patient in particular. So we focused most in sort of the tubercles of her lower lip, but again, gave her a smidge in the corner just so that she gets some hydration out of it. And again, we're using sort of a lot of different techniques here, linear threads, fanning, and then in a minute, we're going to do some vertical struts as well to help bring down that lower lip to give her a little bit more of that pout. So that's why I'm laying these vertical struts at this point, just to try and pull that lower lip down so she gets that pout. And gives us a little bit more lip show. And again, you can see that my needle is fairly superficial. You can definitely see the blanching of the needle. This is a little bit of the V to M technique. Again, the point of this is to pull the lip down, accentuate the tubercles of the lip. And so in an area where you feel like you need that, certainly it's appropriate. So at this point, I just call this fine tuning. So everywhere has had filler, and I, will take a step back and look at the patient and sort of decide, is that symmetrical? Does an area need a little bit more product, or is there an asymmetry that I can balance at this point? So this tends to be pretty nitpicky, which your patients are going to appreciate. Really, that fine, close attention to detail is going to give them those really beautiful lips once everything's all healed. And so that's exactly what I'm doing, just adding a couple of little tweaks here and there just to make sure that I'm happy with how the end product turns out. And then post-care, of course, care for post-care instructions for any lip filler would be the most important things is notify me if you're having any abnormal pain, any blanching of the tissue, modeling of the skin, any indication that the tissue is not being well perfused. The patient would need to notify the provider immediately. Having a plan in place to manage vascular complications is necessary in every practice. And so that is something I educate every one of my patients on before they leave so that they know when to reach out if something doesn't feel or look right. And so now you can heal. We've sort of got our finished look here. She's got a couple of these bruises, which I'll check capillary refill on. And they do perfuse really well. So we're happy to send her out the door. Thanks so much for watching. I hope you enjoyed watching our precision lip technique.